Assalamu alaikum. Beta, in this video lecture, I will deliver the lecture on germ cell tumors of the ovary. In the previous videos, I have covered the surface epithelial tumors of the ovary. Surface epithelial tumors of the ovary that includes the mucinous tumor, the serous tumor, the endometrioid ovarian tumor, and the transitional cell tumor, and clear cell carcinoma as well. Okay, these all are, by the way, the tumors of the ovary which arise from the surface epithelium. But now from onwards, I'll be delivering the germ cell tumors of the ovary. That means they arise from the germ cells. Okay, these tumors make up 15 to 20% portion only of all the ovarian tumors. Okay, so they look not really common, but yeah, they make up 15 to 20%. They bear similarity to germ cell tumors in the male testes. Okay, so male testes can also develop the germ cell tumors, but obviously we are here talking about the germ cell tumors of the ovary, that is the female gonad. Okay, out of all the germ cell tumors, the most common germ cell tumor is the benign cystic teratoma. What is this, beta? This is the most common GCT, germ cell tumor. Other germ cell tumors are not that common, but this germ cell tumor of the ovary, benign cystic teratoma, this is really important and really common. Okay, germ cell tumors, beta, they can arise from the undifferentiated cells, which are undifferentiated and not differentiated to certain tissue. Okay, so arising from the undifferentiated cells, they are dysgerminoma or and embryonal carcinoma. And the germ cell tumor which arise from the embryonic structures, they are called teratoma. And the tumors, germ cell tumors which arise from the extra embryonic structure, they include the non-gestational choriocarcinoma and yolk sac tumor. Non-gestational choriocarcinoma and the yolk sac tumor. This is the classification of the GCTs, that is germ cell tumors. Okay, germ cell tumors, again, they can arise from the undifferentiated cells. They include dysgerminoma and the embryonal carcinoma. Some arise from the embryonic structures, that include the teratoma, that includes the most common variety, and the extra embryonic structure from where choriocarcinoma, non-gestational choriocarcinoma, and the yolk sac tumor arise. In this particular video lecture, beta, I'll deliver the teratoma. Okay, so let's start with the teratoma. Starting with teratoma, beta, teratoma. Um, okay, as I told you that it arises from the embryonic structure. Okay, and this teratoma includes three categories. It can be benign, that is very much mature, and it can be malignant, that is immature, or it can be monodermal or highly specialized teratoma. You will better understand all these three when I'll be talking about these three separately. Okay, so starting with this most common teratoma, that is the benign mature teratoma, and then then the monodermal teratoma, and then the immature malignant teratoma. Let's start with this mature, that is the most common benign teratoma. So the mature benign teratoma, let me tell you, beta, they are more cystic. If you talk about this tumor, the benign variety of teratoma, they are more cystic and they are called as dermoid cyst. Why do we call it dermoid cyst? First of all, that why do we call it cystic? Because this benign teratoma is very much like a cystic structure. Okay, sorry, very much like a cystic structure. Very much like a cystic structure, and this cyst is called the dermoid cyst. Why do we call it dermoid cyst? Because they are almost always lined by the skin like structures. This tumor is growing inside your ovary. Okay, and this is having cystic structure. And why do we call this cyst as the dermoid cyst? Because they are almost always lined by a skin like structure. This is the benign cystic teratoma. So it will be lined by skin like structures. I will show you the pictures better. Okay, and if we talk about the incidence of developing the benign mature teratoma is high in young women during their active reproductive years. Okay, And this mature benign teratoma is occasionally with associated with paraneoplastic syndrome, that is the inflammatory limbic encephalitis. Inflammatory limbic encephalitis is the central nervous system disorder. So with this disease, patient may present mature benign teratoma. Okay, so don't forget, if somebody is suffering from inflammatory limbic encephalitis, make sure he is having mature benign teratoma or not. Okay, so now let's talk about the morphology of the benign teratoma. Okay, where you will better understand about this tumor. Okay, right. The morphology. In morphology, we come to know that the bilaterality of this tumor, that means how often this tumor appears in both the ovaries, is in 10 to 15% cases. That means 10 to 15% cases of the benign teratoma, they appear bilaterally. That means in both the ovaries. Okay, if we look into this tumor grossly, you will come to see there is a unilocular cyst. As I mentioned earlier, that it is a cystic tumor. It is a cystic tumor and there is a unilocular cyst, just like this. There are no further divisions inside. There are no further loci inside. So it is a unilocular cyst, and this cyst contain some structures like hair follicles and the sebaceous material. Don't confuse yourself with this here. You will better understand what I'm trying to say when we go a little ahead. So okay, for now you understand how does this tumor appear grossly. It is simply a unilocular cyst. Okay. When you section this cyst, when you cut this, when you cut section this cyst, this benign teratoma, then you will see that the wall of this cyst, that is the teratoma, it is actually lined by the opaque gray white wrinkled epidermis. Okay, so that means if you cut section this tumor, you will see it is lined by epidermis, that is the skin. Okay, and below that epidermis you will find some hair follicles and the sebaceous glands as well. Okay, within the wall it is common to find some other structures. Okay, the wall is lined by epidermis, and within the wall it is common to find some structures like the tooth structure. You may find some tooth, some not complete tooth, or there may be a little, tooth structure, some areas of calcification, and the protruding hair shaft. That's really interesting to know. You may find tooth structure, area of calcification, and some protruding hair shaft and other adnexal structures of the skin, like the sebaceous glands. Okay, right. With this, there may be some other derivatives from other germ layers. There may be some other derivatives from other germ layers, like like there may be cartilage present in the tumor, or bony component, or thyroid tissue, or neural tissue may also be present in this tumor. Okay. So far, what did we learn, beta? We learned that this benign teratoma occur in 10 to 15% cases bilaterally, involving both the ovaries. Okay. And one more thing, that how does it appear grossly? Grossly कैसा दिखता है बेटा? It looks like a unilocular cyst. इट लुक्स लाइक अ यूनिलोक्यूलर सिस्ट, सिंगल सिस्ट. ओके, और उसके अंदर जब आप इसको कट सेक्शन करते हो तो देखते हो कि इसकी वॉल जो है इट इज लाइंड बाय skin epidermis. Okay, and along with this epidermis in the wall, there are some other structures present that are very interesting to know, that there may be some tooth component present, there may be some areas of calcium deposition, that is the calcification, and there may be the protruding hair shafts present, and some other skin adnexal structures like the sebaceous glands, and some other, structures from the other layers like the ectoderm, endoderm, or the mesoderm. Some other structures like the cartilaginous structure, bony component, thyroid tissue, or the neural tissue may also be present. I hope you are clear with this, beta. I hope you are clear with this, beta. I can show you the gross picture of this tumor. Yeah, just a second, and let me zoom into this. This is the gross picture of mature benign teratoma. This was a complete cyst जिसको हमने कट सेक्शन करके आधा कर दिया है, आधा ऐसा इस तरफ और आधा ऐसा ये रहा कट सेक्शन करने के बाद. ये एक कंप्लीट सिस्ट है जिसके अंदर आपको ये भरपूर हेयर फॉलिकल्स दिखाई दे रहे हैं. ये भरपूर हेयर फॉलिकल्स दिखाई दे रहे हैं, और जिसकी जो वॉल है, दिस वॉल इज लाइंड बाय एपिडर्मिस. दिस वॉल इज लाइंड बाय
epidermis, and these are the hair fall, these are the bunch of the hairs. Okay, this is the gross appearance. Okay, this is the gross appearance. This is a complete unilocular cyst. और जब इसको कट लगा के देखा तो इसकी wall, it is lined by the epidermis. I will show you the microscopy where you will see this wall in the better view. Okay, having the epidermis, and these are the hairs present, right? After this, beta, if I take you to the microscopy of this tumor, then okay, as I mentioned that this cyst is lined by epidermis, having a stratified squamous epithelium with underlying sebaceous glands, hair shafts, and other adnexal structures of the skin. So let me show you the microscopy beta of this tumor, where you will better understand and you will see that yeah, it is actually lined by the epidermis, below which there are some structures of skin. Let me just focus into the picture. Okay, if I zoom into this picture, you can see beta, this is the epidermis. This is this nice little structure. This is the epidermis beta. Okay, and below epidermis you can see, if you go, this is a hair fall. This complete is the epidermis. This complete is the epidermis, which is present in the wall of the cyst. Okay, lining the wall of the cyst, and below is this nice little hair follicle. And what is this structure? This is the sebaceous gland. Okay, isn't it giving you a complete picture of the skin, where this structure is the epidermis lining the wall of the cyst, and below is the hair follicle, and this is the sebaceous gland. Okay, this is the microscopic appearance of this tumor beta. Right? I hope you are clear with this. Right. One more thing to be added here, beta, after getting done with the microscopy, that the dermoid cyst sometimes incorporated within the wall of the mucinous cyst adenoma. How interesting it is. What is mucinous cyst adenoma? I have previously talked about this. Mucinous cyst adenoma is the benign tumor that arises from the surface epithelium of the ovary. So if you have ovary and on that ovary you develop this mucinous cyst adenoma, अगर आपको ऑलरेडी ये ट्यूमर प्रेजेंट है तो बहुत मुमकिन होता है कि इस ट्यूमर के ऊपर एक और ट्यूमर आ जाए, दैट इज योर dermoid cyst, and this is actually your benign teratoma, right? And only 1% of the dermoid cyst, only 1% of the dermoid cyst, they show the malignant transformation, that is they develop into the malignant condition from the benign tumor. Okay, and it can be the squamous cell carcinoma. Squamous cell carcinoma, that means arising from the skin component of this tumor, or it can be the thyroid carcinoma arising from the thyroid tissue of this tumor, or it can be the melanoma arising from the skin component of this tumor, right? मैंने कहा था ना बेटा, मैं दोबारा जरा दिखाऊं कि इस ट्यूमर के अंदर स्किन टिश्यू भी मौजूद है, थायराइड टिश्यू भी मौजूद है, न्यूरल टिश्यू भी मौजूद है, टूथ स्ट्रक्चर भी मौजूद है। तो ये पूरा बिनाइन ट्यूमर, इसके अंदर इतने सारे स्ट्रक्चर्स मौजूद हैं, तो मैलिग्नेंसी तो कहीं से भी निकल सकती है ना, थायराइड टिश्यू से भी निकल सकती है। थायराइड टिश्यू नॉट इन योर नेक, थायराइड टिश्यू दैट इज प्रेजेंट इन योर ट्यूमर, उसमें से कार्सिनोमा डेवलप हो सकता है। अगर ये स्किन मौजूद है आपके ट्यूमर में, बिनाइन टेराटोमा में, तो उसमें से मेलानोमा अपीयर हो सकता है, उसमें से स्क्वामस सेल कार्सिनोमा अपीयर हो सकता है, राइट? I hope you are clear with this concept, beta. One last thing about the benign teratoma, that the karyotype of almost all the benign ovarian teratoma cells is 46XX. If you have a look at the benign ovarian teratoma, that is the benign tumor, and have a look at the single cell, each cell of this tumor, you will find inside each cell there is 46XX. What is this indicating? And this is indicating that majority of the teratoma, they arise from the ovum. Obviously this is the reason why they are having 46XX, right? This is all about beta the benign teratoma, that is also called the dermoid cyst. Right, now let's continue with, okay, let's go a little ahead and following, yeah, this. Okay, what we discussed was the benign teratoma, and it was showing components of different germ layers, ectoderm, endoderm, mesoderm. It was having thyroid tissue, skin tissue, neural tissue. It was showing so many components. लेकिन अगर if there is only one element dominating, then it is called monodermal teratoma. In case of benign teratoma, which we just discussed, there were so many components, there were so many elements: ectodermal element, endodermal element, mesodermal element, right? But if instead of having these so many elements, if any one element predominates, लाइक अगर स्किन टिश्यू है तो स्किन टिश्यू हो, दूसरा कोई टिश्यू ना हो, तो उसको वो फिर बेटा बिनाइन टेराटोमा नहीं है, वो है एक्चुअली मोनोडर्मल टेराटोमा. Monodermal or specialized teratoma. By the way, it is rare and it is of two types. It can be struma ovary or it can be the carcinoid tumor. And remember, the monodermal or specialized teratoma is always unilateral. Struma ovary is one of the types of the monodermal teratoma, which is composed entirely of the mature thyroid tissue. Look, entirely composed of the mature thyroid tissue. जो बिनाइन टेराटोमा हमने पीछे डिस्कस किया उसमें तो थायराइड टिश्यू था, न्यूरल टिश्यू था, स्किन टिश्यू था, लॉट्स ऑफ थिंग्स वर देयर. बट मोनोडर्मल ट्यूमर, monodermal teratoma is the condition where one element predominates. One of the types of the monodermal teratoma is a struma ovary, where what tissue is predominating? Thyroid tissue. Okay, and it may be active, it may be producing some thyroid hormones, so it can be functional, so it can lead to hyperthyroidism as well. Don't take it non-serious. It is really important condition because there is some thyroid tissue. There is some thyroid tissue. Even it can produce some thyroid hormones, leading to hyperthyroidism. Okay. And another type of the monodermal or specialized teratoma is ovarian carcinoid. Ovarian carcinoid is the condition where there is, intestinal tissue very much dominating. Intestinal tissue. Okay. And this tissue may be functional in producing 5-hydroxytryptamine in cases if this is very large. If the ovarian carcinoid is large, greater than 7 centimeter, so it can be functional and can produce 5-hydroxytryptamine. And this 5-hydroxytryptamine, what does it do? It can cause carcinoid syndrome. What is this carcinoid syndrome characterized by? Carcinoid syndrome is characterized by, people may come up with flushing, diarrhea, some respiratory symptoms like the wheezing and the shortness of the breath, the abdominal pain and the nausea, vomiting, and in very advanced cases, there may be heart failure. Okay, right. So there are two types again, beta, of the monodermal or specialized teratoma. Two types are there. One is the struma ovary, one is ovarian carcinoid. Struma ovary में thyroid tissue मिलेगा, ovarian carcinoid में intestinal tissue मिलेगा. Thyroid tissue के केस में thyroid tissue can be functional, can produce the thyroid hormone. In case of the ovarian carcinoid, intestinal tissue is there, and this intestinal tissue can be functional, can produce this molecule that is the 5-hydroxytryptamine. और अगर ये भरपूर अमाउंट में सीक्रेट होता रहा तो इससे क्या हो जाएगा? कार्सिनोइड सिंड्रोम, which is characterized by all these clinical features. One thing to be noted here is that beta primary ovarian carcinoid must be distinguished from the intestinal carcinoid, which is always bilateral. Look beta, this is your ovary, okay, and you can develop this condition called ovarian carcinoid. This condition called ovarian carcinoid. Okay, and the carcinoid can also be developed in your intestine beta. If let's suppose this is your intestine, so ovarian carcinoid can also develop in the intestine. Sorry, not ovarian carcinoid. Carcinoid can develop anywhere, especially carcinoid can develop in the intestine, carcinoid can develop in the ovary. But remember, very important thing, agar let's suppose I develop carcinoid in my intestine, it can go and metastasize to ovary. तो हमें कैसे पता चले कि हमारी ओवरी के अंदर जो कार्सिनोइड ट्यूमर है वो ओवरी के अंदर ही ओरिजिनेट हुआ है या फिर इंटेस्टाइन में कार्सिनोइड डेवलप हुआ था फिर वो वहां से मेटास्टेसाइज होकर ओवरी में आया? दोबारा रिपीट करते हैं क्वेश्चंस को. हमें कैसे पता चलेगा बेटा कि जो कार्सिनोइड हमारी ओवरी में है वो ओवरी से ही ओरिजिनेट हुआ है, ओवरी के जर्म सेल से, या फिर वो कार्सिनोइड इंटेस्टाइन में ओरिजिनेट हुआ था, इंटेस्टिनल टिश्यू से डेवलप हुआ था और वहां से फिर मेटास्टेसाइज होकर ओवरी में आया है? तो इसका जवाब ये है कि अगर बेटा कार्सिनोइड आपके इंटेस्टाइन से मेटास्टेसाइज होकर आया है तो वो हमेशा बायलेटरल होगा, दोनों ओवरीज को इन्वॉल्व करेगा. लेकिन अगर कार्सिनोइड ओवरी से ओरिजिनेट हुआ है तो वो ऑलवेज इट इज यूनिलेटरल. लुक, primary ovarian carcinoid. Primary ovarian carcinoid, the ovarian carcinoid which primarily originates from the ovary, must be distinguished from the intestinal carcinoid which is always bilateral. अगर intestine में carcinoid develop होता है और वो ओवरी के पास आता है मेटास्टेसिस करके, तो वो हमेशा बायलेटरल होगा. ओके, राइट. और बेटा अगर एक ओवरी में दोनों कंडीशंस डेवलप हो जाए, स्ट्रोमा ओवरी और कार्सिनोइड साथ में, तो दैट कंडीशन इज कॉल्ड stromal carcinoid, and that's a rare condition, by the way. Okay, right. Right after this, beta, what have we covered so far? Firstly, I told you about the benign teratoma. After benign teratoma, I told you about the specialized, that is the monodermal teratoma. So we are done with the benign teratoma, specialized monodermal teratoma, and it's now time for the malignant teratoma. Malignant teratoma, this is also rare. I told you, but the benign one is most common. The specialized one and the immature malignant teratoma, they are rare. Okay. And how do you differ this from the benign teratoma? It is differentiated from the benign teratoma in that the component tissue resemble the embryonal and the fetal tissue. That means the tissues which are present in the immature malignant teratoma of the ovary, they are not mature tissue, they are immature tissue. देखें बेटा, बिनाइन टेराटोमा के अंदर भी बहुत सारे कंपोनेंट मौजूद थे. स्किन टिश्यू था, थायराइड टिश्यू था, न्यूरल टिश्यू था. ऑल दोज टिश्यूज आर मेच्योर, बट द टिश्यूज विच विल बी प्रेजेंट हेयर, दे विल बी इमेच्योर. ठीक है. Like you can see, if I take you here, you can see in this malignant tumor there can be hair follicles, there can be sebaceous gland, there can be cartilage present, there can be bone present, there can be areas of calcification, okay, with the necrosis and hemorrhage, and a very important thing, that is the neuroepithelium. All these structures, hair follicle, sebaceous gland, cartilage, bony structure, neuroepithelium का होना, all these structures are immature. Almost all of these were present in the benign teratoma as well, but in that case they all were mature tissues. They are immature. Like, very important thing is immature neuroepithelium. Like immature, it is an immature fetal like tissue, distinguishing it from the benign tumor. Okay. In case of benign teratoma, the mature tissue was present. If we talk about the incidence of this malignant teratoma, so it is common in the pre-pubertal adolescents and the young women. Pre-pubertal adolescents, puberty से पहले की एज फर्ज करें 10 साल, और यंग वुमेन फर्ज करें अप टू 30 ईयर्स. यही हो सकता है. तो बेटा मीन एज क्या हो गई? 18 से 20 साल. 18 से 20 साल की उम्र में बेटा इमेच्योर मैलिग्नेंट टेराटोमा होता है, हाई इंसिडेंस के साथ. मॉर्फोलॉजी में ग्रॉसली आपको ये ट्यूमर बड़ा बड़ा बल्कि मिलता है, और इसकी एक्सटर्नल सरफेस बड़ी स्मूथ होती है, और इसके कंपोनेंट्स मैंने आपको बता दिए जो कि इमेच्योर होते हैं, फिटल लाइक टिश्यूज होते हैं. ओके, and that's all about beta this lecture on teratoma. I hope you got some concepts. If you did, you can appreciate me by liking to the video, subscribing to the channel. Thank you so much, beta. Class dismissed.